Okay, so this week I'm in clinic all week. So that means that I have to be here at a certain time, and I have scheduled patients that come to see me on their appointment time, and I have to be ready for them. Usually on clinic days, I like to arrive to the office around 8:15 or 8 to have my coffee, and the first patient is usually at 8:30. And then I have back-to-back patients all the way to noon. Around noon, I take an hour lunch break, which is actually very, very good. Sometimes in the past, I will say, oh, I will just stay during my lunch break doing charting, but I realized that I really do need a mental break, and it's nice to chit chat with your colleagues and laugh a little bit and maybe troubleshoot some patients that are more complicated. And then around 1, I start seeing again patients back to back, usually to around 4:30. Clinic day is steady. You get to dress a little bit nicer if you're into that. Not that this sweater is really nice, but you know, in the hospital, usually I wear scrubs, and I love that. And here we're supposed to dress more like, I don't know, dress pants and shirt, even though I like sweaters. But that's besides the point. But it depends on personality. Some people like the dressing nice, the steady pace, predictable, what's gonna happen hour by hour. You have your medical assistant helping you, you have nurses, you have a secretary, so it's very nice and steady. Me, I prefer inpatient, which is a little bit more crazy, disorganized, you wear scrubs, you don't know what's gonna happen hour by hour. You might be there for 10 hours or you might be there for 6 hours. You don't know, it depends on how sick the patients are. But different things, different personalities. I love that our role is hybrid, so I get to experience both and I don't get bored. So after I do clinic for a couple of weeks and I'm like, okay, I'm done with all this scheduling and nice dressing because I don't really have nice clothes. I'm ready to put my scrubs and go into the hospital. So just a little insight. I hope that helps for anyone that is trying to decide outpatient versus inpatient.